All right, welcome everybody. Good afternoon. My name is Corin Clark. I'm with the Scranton Area Community Foundation. I am a community impact manager responsible for NEPA Thrives, NEPA Moves, and supporting our housing coalition. I thank all of you for joining us today for our kickoff event for the Workforce Barrier Summit, addressing obstacles to recruitment and retention. For those of you who are originally signed up for the in-person, I appreciate the flex. Today's program is a two-part, and I'm very excited that we have an amazing group of presenters and guests today that are joining us. So in that, what I'm going to do is get us started and do an introduction. I'm ecstatic to have Jill Avery Klaus from the Institute here today to present on the NEPA workforce landscape, now navigating challenge and change. And with that, I'm going to go ahead and hand it over to Jill.
Thank you, Corin. Good afternoon, everyone. Again, my name is Jill. I am president at the Institute. And if you want to move on to the next slide, I am going to talk just for a couple of minutes about who we are and what we do, in case you are not familiar with us. We are a small nonprofit. We operate as a partnership of 14 of the region's colleges and universities. And we are also very generously supported by a number of our partners in business, industry, and philanthropy. We offer data analytics and community-based research services. Some examples of that work include program evaluations, strategic planning support, market and feasibility studies, economic impact studies, wage analysis, that sort of thing. Overall, our mission is to facilitate data-driven insights for the purpose of improving economic well-being and quality of life throughout Northeastern Pennsylvania. Which brings me to the reason I'm here this afternoon. I'd like to share just some general information about the region's workforce, what's been going on, what trends look like, what we might expect in the future, considering some of the challenges that are popping up in our way. I do want to note that when I refer to the region or Northeastern Pennsylvania, just for purposes of our discussion today, I'm talking about Lackawanna, Luzerne, and the surrounding counties. And I will also mention COVID quite a bit, but I want to make a distinction there. I'd like to clarify that I'm not really identifying the pandemic as a cause of any of our workforce challenges. Really, these challenges were all there prior to the pandemic, and they were then exacerbated by the pandemic. So with that, I'm just going to jump in on the next slide and share some general industry-related characteristics. If you can see the little gray lines on the chart there, they represent national averages. And then the blue lines, of course, represent Northeastern Pennsylvania. It might not be a surprise to anyone here that we are above average in terms of healthcare and social assistance. That is one of our biggest industries. We're also big in retail, manufacturing, definitely transportation and warehousing, and education. I want to give a shout out to the agriculture, forestry, fishing, and hunting sector that's way down at the bottom there. They are very small, but they're actually one of our biggest growing sectors. So kudos to them. In general, this diversity or the strength of the multiple different industries demonstrates some economic resilience on our part. So if a particular industry suffers or is threatened in some way, we have others to rely on. So that's a good way of helping us stay as vibrant as possible. In terms of occupations here, we are way above average as far as transportation, material moving goes. We're also good in terms of production, healthcare, and some other areas that you can see in terms of comparison against those national rates. And so with that, that's just kind of a quick snapshot of what the workforce landscape is looking like. And on our next slide, we can shift gears a bit. and talk about some prominent challenges. This little bulleted list is by no means all inclusive. These are themes that we at the Institute have heard about over the course of quite a few years, kind of anecdotally collected across the board. And I'm sure we will have time to talk a little bit more about them. Maybe you would like to add some things to the list, or if there's things that we missed, we can get into that as well. So I will take a few minutes just to expand on each of the bulleted categories, starting with demographics. This is really kind of a big one. We have an aging population, meaning that a substantial share of the population, and therefore our workforce, is on the older end, and there are not enough people on the younger end to fill the positions that become available as people retire. So in other words, there's a high retirement risk. It's really a numbers game. And on top of that, we have a significant portion of what some people call opportunity youth. Other people's refer to them as disconnected youth, but regardless of the term, these are individuals aged 16 to 24 years old. They are either underemployed or unemployed or have not yet completed appropriate education. And so therefore they're struggling in the workforce. And as I mentioned, people in this younger age group are very much needed to move us in the right direction in terms of workforce numbers. There's a lot of potential for engagement there. There is some fluctuation depending on the county, but overall, our region has not seen a whole lot of population loss. That is not due to natural population change. And what I mean by that, it's not because births are outnumbering deaths necessarily. It's really because of in-migration. We see a lot of new residents come in from other parts of Pennsylvania, from other states, and from other countries. And that's not a bad thing. We as a community can and should continue working to accommodate the in-migration. But there are some accommodations that we have to continue to consider. So for example, the influx of diversity does mean that there are some language barriers. So people who are speaking languages other than English don't necessarily have equitable access to resources, specifically education and employment resources that might be available to them. So there's opportunity for improvement there. We're also discovering that licensed or otherwise credentialed professionals who move into the state, whether from other states or from other countries, cannot always work here because their licensure is not recognized. This is a particular challenge in healthcare, but it certainly goes for other occupations as well. So we have professionals who are desperately needed and who are in good standing in terms of their practice areas, no strikes against them or anything, but they simply cannot practice here without maybe redoing their residency programs or re-enrolling in school, and that's often just not feasible financially or otherwise. And on top of all of that, regions across the nation are facing workforce challenges just like us. So that means we're competing with the rest of the country. Everyone is kind of desperate to attract and retain people. So for this reasons, I think it's important to highlight how everything is so interconnected. All of the things that make up the ecosystem in Northeastern Pennsylvania really have to be considered to continue to attract people here and keep them here. Things like desirable housing and education and infrastructure and even entertainment and education or recreation and all of those things. On our next slide, moving on to transportation, I don't think this is going to be a surprise to anybody. We all know that transportation, I think, has been a challenge for many years. And although it has gotten better, there are, because there are really critical programs and initiatives that are in place that are helping to mitigate the issue, but it is really persistent. And again, to attract and retain people, we have to think about the whole ecosystem, and transportation is a huge component of that. So bus routes, for example, they do not always cover complete trips, whether in neighborhoods or residential areas. or employment centers and industrial parks. Many of those areas are not safely walkable. I'm not sure if any of the industrial parks have fully equipped sidewalks or bus stops or anything like that. For example, they're not necessarily lit at night. The routes are also limited in terms of scheduling, which is especially challenging considering that we have a whole lot of shift work in our region, whether off hours or holidays, overnights. Those are our biggest sectors like healthcare, warehousing, manufacturing. So the people work around the clock, but the buses do not. And when we're talking about transportation, I think sometimes the vehicle issue itself sort of gets overshadowed by the bus issue. There's also the whole train thing, but I don't know if we need to go there today. But in terms of vehicles, it is true that most of our households in the area do have personal vehicles. Those costs have skyrocketed, however, and many households have to share vehicles with other members. So there's like a priority thing happening there. And care and maintenance, of course, is super costly. So that's quite a burden as well. We hear about people, driving with uninspected vehicles or bad brakes or bald tires or those kinds of things that are not safe or reliable, but they're kind of doing their best to limp along and get to work if possible. But it does lead to call-offs and turnover, all very expensive, not just for families, but for employers as well. Maybe it goes without saying, but I'm going to say it anyway. All of these things are especially challenging for people who live in rural areas too. On our next slide, we have housing. There's a housing crisis going on, and this is another one of those areas that were problematic prior to the pandemic, but it has gotten exponentially worse since 2020. I mentioned all of that in migration and that it is good, but it is not sufficient to be able to tolerate a whole lot of population growth. During lockdowns, a lot of people moved into the area where we already had a limited stock, and that drove prices upward. And on top of that, we had the inflated costs from the pandemic itself. So it was a multi-layered kind of thing. And although that has alleviated somewhat, it has by no means completely relaxed. We see the same trend happening with rent on the next slide. Renters tend to be a little bit more, no, not even a little bit more, significantly more housing insecure than homeowners. And housing insecurity occurs when 30% or more of household income must be allocated to housing costs. So you can see that depending on the county, we're hovering right around that line of insecurity. And research tells us that housing security affects things like academic performance in children, workplace performance, productivity, mental health. It's a social determinant of health. So an indicator of economic vitality and very, very important. On our next slide, I know I said that we have a limited housing supply, but the one that we have is also really, really old. Most of it was developed prior to, most of it was developed prior to 1970, but significant portions were also developed prior to 1940. So all very old, very limited development more recently. Pike County is a little bit of an outlier there in terms of development. And there's a few reasons for this lack of development, but as an example, I want to point out zoning challenges. That's a big one among them. There are all sorts of contradictions and complexities across ordinances depending on municipality. It doesn't leave a whole lot of incentive for developers to build unless they're building luxury housing because that's, a better profit. So in Luzerne County, for example, I believe there are 76 municipalities. About 50 some have their own ordinances, and I think 20 fall under the county ordinance. So there's I don't know, altogether 56, 57 different ordinances. I might be jumbling up my math there, but there are dozens. And developers have to navigate those before they even think about building. Each of those boroughs and townships have different or similar naming conventions, and those conventions might mean contradictory things about what is considered residential and allowable. My point being that it's not a very appealing landscape to navigate, and that's part of the challenge that we're facing there. So I've kind of droned on a little bit for the first several slides, and I want to check in and see if this is a good point to break and see if anybody has any questions or comments before I keep going. We're good?
I'll just jump in, Jill. I think one of the things,
Mhm.
we're hearing a lot as we look at what different communities have done in some cases to help with the healthcare challenges is look at, are there opportunities to invest in housing as an incentive for that? And so that's
Mhm.
why, putting that out there and putting the percentage of income probably is a great precursor to a way to potentially mitigate some of the challenges, It's something that we're learning and trying to learn more about.
Yeah, and it kind of gives a whole new meaning to the concept of affordable housing. I think traditionally people think of affordable housing as like low income housing or subsidized housing, when really it's truly affordable housing for teachers and, I don't know, police officers and just, everybody who, are just trying to live with some type of a modified or a modest but dignified living, we'll call it. Yeah. Okay. In that case, if nobody else has any comments, I will jump back into it. And that's going to take me to childcare, um, which is probably about as big of a challenge as housing lately. There's a bit of a paradox going on with childcare as well. Um, in some ways, it's similar to the healthcare sector in that there is an imbalance of supply and demand that was in place long before the pandemic. But wages for childcare workers are typically relatively low, so that heightens the competition with other industries to be able to pay them more. So it's harder to retain them for childcare providers. Um, During the pandemic, the childcare sector got absolutely decimated. They could not reopen at the same rates that many other businesses reopened or facilities reopened. So those that did survive continued with their workforce issues, um, on top of even more demand that resulted from fewer facilities. So that added to their wait lists. But that other layer that I mentioned has to do with caregiving occupations in general, which is that they're quite gendered. They're usually, not always, of course, but often filled by women. And women have had a more difficult time re-entering the workforce after COVID because they're also the primary caregivers at home. Therefore, they're also facing those long waiting lists and high costs for care, um, which results in part from all of that demand. So I kind of think of it as this childcare paradox that's happening. And on the next slide, this is national data. This is not specific to the region, but it paints a good picture of what we're looking at in terms of people who are able to secure some sort of childcare and maintain their employment, maybe. Maybe they have managed to find some sort of neighbor or family member or home care, but they're still dealing with occasional sick, sometimes they have sick children or their babysitters have fallen through. It's just not quite as reliable as more formalized care. And so they're struggling to maintain their employment, and it doesn't just cost families. Um, I'm sure you know that absenteeism in the workplace is very, very expensive. It interferes with performance and productivity, and that leads to turnover. Then we're talking about rehiring and training. So that's also super expensive. The overarching economic costs of childcare limitations, they're just kind of astronomical. And then, okay, perfect. That's the right slide. This is back to local data, the 8th Congressional District, which is Lackawanna, Luzerne, Monroe, Pike, and Wayne counties. This comes from a childcare study we did a little bit over a year ago at the Institute. The chart illustrates responses to a parent survey that we did. I want to note that the sample size of these responses was kind of small, so we want to interpret what they're saying with caution. However, I do think it's noteworthy to say that all of this data comes specifically from parents who work traditional hours only, like 9 to 5, 8 to 4 type of schedules, Monday through Friday. And you can see that even they are struggling with childcare. So I think it's safe to make an assumption that those who are working non-traditional schedules are struggling just as much or more. There's not a whole lot of daycare centers who are operating on off hours or overnights to accommodate those, hospital or warehouse workers. There are a couple, but not nearly as many that are needed. On our next slide, we have a table that comes from that same childcare study, and there's a lot going on here. So I threw in the QR code just in case you need to or wanted to dive into it later. But the important thing to really examine are the costs there. They range from like 10% to 16% of family income. And that is on top of that 29% of housing costs that I mentioned earlier. So right there for families, we're talking about 40 to 50% of income that's just going to housing and childcare. It's not considering transportation or healthcare. Food security is a whole other conversation. It doesn't even account for any sort of fun or entertainment that families and workers are certainly entitled to. And that kind of leads into a scarcity mindset, which I'll talk about in just a minute. So then on the next slide, just a couple more numbers. We know that research so far, some case studies suggest that there's pretty good ROI that's associated with employer-supported childcare. Mid-size and larger companies and organizations have had some success with childcare partnerships or in-house childcare programs. And by in-house, I'm not referring to in-home care. I'm referring to in-organization types of programming. But they have seen a return of about $3 or $4 for every $1 that is invested. So there's maybe opportunities there, some viable solutions to think about collaboratively. And I'm not, what's on, let's see the next slide there. I think we're going to open it up for some more conversation in a few minutes. But first, I would not dare discuss workforce challenges without touching on physical and mental health. People either cannot work or cannot work well if they're not healthy, of course, and it's difficult to stay healthy when access to care is limited by cost and shortages. Another pandemic-related point, mental health issues elevated during the pandemic astronomically. And that's true for the broader population, but the healthcare workforce itself has really grappled with stress and burnout. So those frontline workers that are, desperately needed and valuable, they often have to make difficult choices to leave their occupations in terms of, favoring or taking care of themselves. And that's a whole other hit to the workforce landscape as well. It kind of goes back to the interconnectedness of everything. And then back to that scarcity mindset kind of point that I referenced. And it wasn't on my bulleted list earlier that I shared, so I apologize. But when I reference scarcity, I'm just kind of talking about lack in general, lack of transportation or income or housing or childcare or emotional support or food. It's a type of trauma that leaves little mental capacity or bandwidth for people to be productive and perform their jobs well. They really have to be focused on their day-to-day needs and their basic survival. It's kind of like the hierarchy of needs concept. They're much more worried about dinner than, completing tasks appropriately in the workplace. And their executive function skills then are hindered by this type of scarcity trauma. It affects emotional regulation and memory, organization, time management, all things that are super valuable in the workplace. Even just, for example, I heard from an employer once this employer had started a transportation assistance program that allowed for small loans to help pay for vehicle repairs. One of this person's employees was able to make some vehicle repairs and get his car inspected, and then came to her and said, like, I really hope that I get pulled over, because, and obviously I don't think he really wanted to be pulled over, but the fact that he was legal and on the road and can just go to work, that in and of itself must be such a tremendous weight off of his shoulders. Or the ability to drive down 309 from Mountaintop with brakes that work, once you get to the bottom, or not popping a tire on 81, something like that. All of those things are difficult to really pinpoint. They are not concrete, but they contribute to a level of trauma, or on the other side, mental well-being, that is going to add to workplace performance and then overall community vitality. So with that, we can open it up a little bit. I'm very curious to know if I have missed anything, or if maybe you have had different experiences, or if you have any questions for me about the data in general.
Jill, very nice job. Thank you so much. My question is I know this is being recorded and this will be available to us. Is that correct?
Corin, I think so. Let's see, where's Corin?
She's up there in the corner, but her camera's off.
I mean,
Okay.
it will.
I'm here.
Hi, Corin.
Oh,
So,
okay.
yes, all of the sessions are being recorded. We are lovely. Jill has been lovely enough to also agree to do this session again next week for a similar presentation. But yes, all of these will be recorded and shared out through the event page once
you.
we have them all together.
Wonderful. Thank you so much.
Feel free to put your questions in the chat as well if you don't want to come off mute, but you are welcome to come off mute and kind of share your thoughts, perspectives on what Jill has shared today.
I'd also be curious to know if any of these things are things that are maybe openly discussed in your workplace, or that you've heard from other employers. Are they acknowledged? Do employees feel comfortable going to management to explain their concerns, or do you just kind of get ghosted, so to speak, and employees can't, maintain their employment, and you don't hear anymore, but then you learn more about their circumstances later? Just kind of how that plays out.
I'll jump in while others are adding their questions into chat and thinking about their questions. I think, first of all, thank you. Incredibly informative and useful, well presented. I also think that some of the themes that you hit on regarding the transportation challenges, the absenteeism, I particularly appreciated the breakdown of those that, are off shift, or, elements of that. I think it just reiterates that we really still do have a transportation opportunity with employers in the region, and looking at it that way. The child care component, all of the themes I think that you have the data for really resonate with a lot of our partners that we speak to.
Thank you.
In that, one of the things that I will encourage to share with colleagues and workers is, over the next several weeks between now and the May 1st in-person event, We will be holding individual 1-hour Zoom sessions around transportation, around childcare, around workforce in K through 12. The career links in the chambers are going to come and talk about some resources they have. So there are things happening out there. I think the organization that Jill mentioned about the CAR program, I2M is going to come and talk at one of those. So there are opportunities to invest and look at solving some of these issues, or at least addressing some of the challenges. So I really encourage you to share out with your colleagues about the opportunity to learn more, and then join us on the 1st for the bigger conversation and what we can do to move things forward. I'll read in the chat, Jill. Everything you stated resonates and is reflected in our employment services. There's a lot of barriers for people getting and retaining employment, and I think you addressed all of those. Thank you. And then, is there any indication as to why the 16 to 24 age population is under or unemployed?
Not a holistic definitive indication, but a lot of it has to do with mental health challenges. And I can actually link to, I'll track it down and I'll put a link in the chat to a study on disconnected youth that we did just a few years ago. But short answer, before I kind of veer off on a tangent, is a lot of it has to do with mental health. In some cases, it is associated with like poverty, that scarcity concept, and maybe limited abilities to navigate those and access available resources.
One of the challenges is that support services remain siloed. It is hard to connect to services, and many folks need more than one support service. And that is definitively something that we have talked about in our NEPA Thrives meetings and our NEPA Moves meetings, and in the bigger convenings and collaborations. So we're encouraging those conversations because we are siloed, and we're looking to develop some tools and some resources to kind of address that and moving forward. Are there any other questions at this time? Jill, thank you for putting the link in there.
Sure.
Corin, just real quick, Paul Nardone, you mentioned that these sessions are being recorded in other resources. So being a little new to this, and I know that the Institute's involved too. There's a lot of different organizations doing some brilliant work. Where could I go to find out when some of these other sessions are happening?
So I will put the link in the chat.
Thank
and
you.
then also at the end, we have a QR code. So you can even just hold your phone up at the end and get to the website. But I will definitely put the website's link in the chat for you. And then additionally, if you don't get the link or the QR code doesn't work, you can always email me. My email is corin@safdn.org, and I'll put that in the chat.
Yep. I appreciate all that. Thank you so much.
Oh, absolutely. And feel free to share out my email. I'm happy to send along and kind of guide people if there's specific questions. Again, we're going to be discussing transportation, childcare, education. We have some workforce strengthening organizations coming in. We have a presentation towards mid-April from the Welcoming Center talking about the value of these immigrant and refugee populations that are coming in, and how that is going to help the area. And then we also have some resources on what employers can do in conjunction with community foundations to support the effort. So lots of rich material coming up.
And I just wanted to add, hi, this is Carrie Fallhaber from JobsFirstNYC. I'll be presenting a little bit later, but I just wanted to add to the response about to the question of why, why young adults tend to be in the highest rates of out of school, out of work, or unemployed or underemployed. There's many reasons, and I don't know who said something about disconnected and siloed systems. That's certainly a big contributor. And Jill, your response about the increase in mental illness, visible and not visible, has increased tremendously, particularly in the face of the pandemic. But in addition to that, for young adults, there's a number of things that come into play: education and skill gaps, misalignment of education to the skills in demand. Increase in seasonal part-time work is leading to really high underemployment for that population. And then, obviously the cost of education is a tremendous factor. But something that we're seeing now, and we see cyclically, I think, in this country, is these economic factors. When there's any sort of economic downturns or large swaths of the workforce being laid off from certain jobs, employers have more experienced people to choose from, and underexperienced young adults kind of fall to the bottom of the pile for selection. And it's really challenging to get work-based experience for young adults. So, there's this tension of employers want experienced people, but they have a hard time giving work-based experience to young people. So there's a lot of factors at play.
Carrie, that was great. And your mention about skill gaps and the cost of education. I'm coming from the educational side. I'm at Misericordia University. If anyone on this call, I would love to hear more about those specific skill gaps. What specifically are we missing? How can an institution like Misericordia help, fill some of those gaps? So if anyone here and wants to chat over a cup of coffee or, on Zoom, whatever you want to, I'd love to entertain that conversation with anyone. So please don't hesitate to reach out to me. I think I can put my email address in the chat as well.
Great.
Thank you.
Excellent. Well, if there's no more questions or concerns, for those of you who know me, if we're moving ahead quickly, then I like to keep moving ahead. So with that, I'm going to go and hand this over to Carrie from JobsFirstNYC, and I'm going to start sharing my screen with your presentation, Carrie, and let you take it from there.
Okay, great. Thank you, Corin. So adapting agendas here from what was to be an in-person event, and I'm sad to not meet you all in person, but hopefully we'll have an opportunity to do that soon. This session was really designed to meet two objectives. One, there was an overall objective of the summit to provide resources and, as Corin had talked about, identifying opportunities to really enhance economic development in the region. This panel specifically was focused on the care economy, and we will have a call to action at the end for you all that Corin will talk about, but we're really interested in identifying a group of people, and it sounds like we might have one interested person already in Paul, and hopefully some others that want to come together following this session to do something about these challenges that we're hearing. So let's get rolling. I think we start here with well, let's ask you all, since we didn't already, whoever is here, I'd love for you to drop your name in chat. I love to hear about people's first jobs and what you're doing now. So if you could put your name in, the first job you ever had, and where you work now, where you're affiliated with. It's really interesting for us to think about our own trajectories in workforce from where we started, where we are, and to think about what were the steps along the way that we took to get there. And while you do that, I think we're going back to Jill, who developed a data-specific report related to the care economy. And I'm going to have fun looking at, oh, you could skip forward. Great. Thanks, Corin.
Yeah, me again. I will make it brief this time, just a few minutes compared to the last round of slides. But again, this time I'm going to take a few minutes to talk about how workforce dynamics impact the healthcare sector specifically. On the next slide there. Again, you can see that healthcare is our top industry in the region, and that is in terms of employment. More specifically, we have a huge need for home health and personal care aides. That sector is one of those sectors or occupations that are challenged by low wages. So there's a competitive element in terms of employers there. There's also some significant demand for nurses. Right now, Pennsylvania needs, I think, about 20,000 nurses, and that is expected to grow. And if you're looking at some of these 2034 numbers here in red, it probably looks like the need is actually going to decline a little bit over the next decade. And it does mean that the growth will slow, but it's only part of the picture. That's specific to occupation growth. It does not account for that retirement risk or all of those people who are going to be retiring and those positions that will need to be filled. So it's helpful information, but there's a bigger picture there. On the next slide, yep. This data is sourced from real-time job postings, and they confirm the severe need for healthcare occupations with more than 1,200 unique postings just in 1 month. And we see it again on the next slide. That's looking at skills that are required for open positions. And here's where there's opportunity for a big, long conversation about that skill gap and the education that educational pathways, I guess, to lead to career pathways and comparing them to national numbers, those gray lines there. We can see that need for direct patient care, home health care, patient safety skills, medical record keeping. So everything lines up. And the required education, I think, is on the next slide. Also listed in job ads, when they are listed in job ads anyway, those required educational levels, they vary considerably. And that's a good thing because people with diverse educational backgrounds have opportunities. There's different entry points that are available to them. It's not a completely closed off industry. The same concept holds true regarding required experience. On the next slide. And not only are there many entry points into different careers, but there are great pathways within them. So we have a fabulous stock of higher education institutions. And I'm not just saying that because we've already heard from one of them. It's really true. There's options ranging from programs offering certifications and 2-year degrees onward and upward. Many of our employers also have their own internal training programs and advancement opportunities. So again, there's rich opportunities. It is really an engagement thing with our residents. So if we're looking on the next slide about looking at who is and isn't working, we can examine some labor force and unemployment rates. I apologize if you already know this and it's just like old news, but just to be on the safe side, I want to elaborate that the labor force consists of anybody who is working or attempting to work, looking for a job or maybe between jobs. It is not just a count of the population that is working age. It does not include people who are disabled or retired or students or homemakers. So that said, the labor force participation rate is pretty decent. The unemployment rate is calculated based on that labor force participation rate. And that is where we can kind of see some outliers. That unemployment, again, is particularly high among 16 to 24-year-olds. And these are not the 16 to 24-year-olds who might be in high school or college and simply just aren't looking for work. So they are actively in the labor force. And there is massive potential there that for us to tap into talent and increase engagement. On the next slide, we can see that there are some disparities in terms of race and ethnicity. The labor force participation among Native Hawaiians and that kind of vague 2 or more races category that the federal government uses, the participation is great, but they also have high rates of unemployment. And admittedly, the Native Hawaiian population and the Alaska Native populations are really small in the region. So we would need to be cautious about drawing major conclusions from those numbers. But the population of people who are 2 or more races is significant in our region. And so that figure is telling. That is not a terribly small category or group. The high unemployment rate could suggest that maybe they're trying to find and maintain work, but there are obstacles preventing them from doing so. Conversely, the Black African American population has a low labor force rate, but there's also a low unemployment rate. So employment's good, but for whatever reason, they aren't always able to access the labor force in general. And then I think, as you might expect on the next slide there, this is kind of falls according to logic. Higher levels of education are connected to higher rates of labor force participation, lower unemployment. So that all makes sense. And I think that might wrap up my slides. I hope that this kind of helps frame the opportunities and solutions you're going to hear about from the rest of the panel, unless we have any other comments or questions first. Cool.
Okay.
Actually, can I ask a quick question? I didn't know how to raise my hand. I can't find it. Of the 2 or more races that you had, Jill, with the large number of unemployed, and forgive me if you've already said this, do you think a lot of that is due to ESL issues, or is it literally, is it something else?
I do think that language barriers are significant, and so that probably is a contributing factor. Yeah, but I think that there's more to it as well, with disparities in terms of poverty and access to other resources, and there's kind of disparities almost across the board, depending on the subject matter that we're talking about. So, but yeah, short answer again is that I do think that language barriers are part of it.
Okay.
Thank you, Jill. And Jill's here for the duration, I think. So if questions come up when you think about that data and the healthcare sector and the demographics, you can put those in chat and Jill will keep an eye on that. But to keep us moving next, I'd like to invite on Deborah Diamond, who's the director at the Philadelphia Fed.
Thanks, Carrie. Thanks, Corin, and everyone for inviting me to this conversation. I'm going to, I don't control. So could I see the next slide, please? And maybe the next one, I'll share the agenda. Great, thank you. And sorry for the numbering here, got a little bit of off, but I'll be covering 3 things in the few minutes that I have. One is to talk a little bit about the Federal Reserve Bank and why it's interested in what we call the anchor economy. And by anchor economy, we're talking about universities and hospitals and their role in the economy. And I'll say a word or two about why they're referred to as anchors. And then I'm going to share specific data related to the anchor economy in Northeastern PA from a data set that we've collected. And then finally, talk about an initiative that we have been engaged with in the NEPA region over the last year and a half called Anchors for Equity. And some of you, I know from the names I see up above, have been participating in those conversations where we're leveraging the strong anchor institutions in the region to talk about how they might be assets in workforce participation and workforce opportunity. And this is heading towards a conversation around the care economy, which I will get into in more detail. So that's what I'd like to speak about. So first, the Anchor Economy Initiative. So as I said, we refer to the anchors as hospitals and universities because they are really anchored to place. They don't pick up and move like a corporate headquarters might, or a manufacturing facility or something like that. Anchors are really in it for the long haul in communities. They're also labor intensive. They both employ a lot of people, and often they're the top employers for a region. And so they play a large role in people having access to job opportunity, and a large role in what people are training for in the future, because they see the hospitals and the universities as significant regional employers. And finally, when we were interested in this sector in the economy, because it's so important to the places they're in, we realized while individual institutions might do economic impact studies and demonstrate their impact in a region, we really didn't have an understanding of the sectors collectively and for in regions and across the country as a whole. So we wanted to create a data set that would be a catalyst for communities to talk about the role that these institutions play, why they're important, and how they could be leveraged to better advantage. So the next slide. So when we ask these questions about how important the eds and meds are in a regional economy, we had two ways of asking this question. The first is, what is the economic impact? What does it mean in terms of jobs, income produced, general economic activity, which we measure as GDP? What are the numbers associated with these sectors? And then the second question, which is distinct, is how dependent is this community on eds and meds for economic activity? And here I'll just give a really quick example. The region with the largest impacts from eds and meds in the country is the New York metro region, which you kind of can imagine. It's very large. They have some major institutions, a lot of people. They need a lot of healthcare. They need a lot of education. But when you look at where eds and meds are in relation to their economy as a whole, they don't really over-index on eds and meds impact. They have so many other things going on in their economy that they're not overly dependent on eds and meds. Other regions have different stories. So this is the reason we ask these two distinct questions, and this is what you'll find in the data set. So we'll move on to the next slide. So here I have a QR code if you want to that will lead you to the data dashboard. And I'm sorry, the Scranton profile page is so small. But if you go to the QR code and put in Scranton, you'll see that same data in the data set. And every region in the country has a profile page like this. And fortunately, I printed this out so I can refer to the actual numbers. So what you see there are 32,000 jobs in the Scranton area are attributable to eds and meds. And that includes, we measure economic impact in 3 layers. The direct impact, those are the people who are employed specifically by those institutions, by Misericordia, by Geisinger, your employees. Those are the direct jobs that we count. Then there are indirect jobs. The institutions in your region, they rely on lawyers, and they buy copy paper, and they use landscaping services, and all of those jobs at those external firms, those wouldn't exist without the eds and meds as their clients. So those jobs are, to some extent, some of those jobs are attributable to the eds and meds as well. And then there's a third category of impact, and that's called induced impact. And so when someone comes to campus and buys a sweatshirt or a cup of coffee at a coffee shop off campus, their jobs in those coffee shops and those retail establishments, those wouldn't exist without the hospital or the university campus there. These are the 3 levels of impact that we measure. And then you'll see further down the page, and again, I apologize, it's not, maybe we should turn to the next slide because I think it's a little clearer there. Yeah. This is where we measure the reliance. Some examples of some places and how reliant they are on eds and meds. And you can see here, the United States is average at 1. This is the way we created the data set. And if you over-index on eds and meds, you're, on one side of this line. If you under-index, you're on the other side. And you can see that the Scranton region is basically like the U.S. as a whole. And this refers to, I think, a lot of the sectors that Jill referenced at the very start of her session, where, there really are a lot of strong sectors and growing sectors in the Northeastern PA region, so that while eds and meds are very important, you obviously have other things, transportation, it sounds like forestry is growing, and warehousing and other sectors. Philadelphia, where we think of I'm in Philadelphia right now, we think of ourselves as kind of an eds and meds city, we're at 1.4. But you take like some of these college towns you see on the right side, they're 3 times as dependent on eds and meds as the US and as Scranton. So that's just one example of how we think about how salient, how significant eds and meds are in your region. Okay, the next slide. So one thing you can do with the dashboard is take a look at other places that look like you, that you might not have realized look like you. So what I've done here is I've taken the Scranton area and a combination of your overall eds and meds employment, and that includes all 3 levels of direct, indirect, and induced employment, and your reliance index. And I've sort of done a search in the data for who else looks kind of like the Scranton-Wilkes-Barre area. And this is kind of potentially a suggestive list that if you're thinking about how do we leverage our university and hospital institutions to make a difference, are any of these places doing something like that? And if so, what are they doing? And so this is one of the values of the tool, is that because it covers every region in the country, you can look and maybe have a new definition of who your peers might be and who you could potentially learn from. So that's the data dashboard. And now I'm going to turn a little bit to the Anchors for Equity project that we've been engaged with. One of our hopes for the dashboard and putting out the data set was that it would be a catalyst to action, that regions would see, oh, we represent 32,000 jobs in the region. We should be at the table for economic development conversations. We should be at the table for talking about workforce barriers. So we actually put out a call for proposals from communities to say who would like to have conversations about how to leverage their anchor institutions, their eds and meds, to focus on a workforce issue. Obviously, as significant employers, there's opportunity there. And for universities as training partners and education partners, there's opportunity as well. And so led by a few institutions, including the Institute in the Scranton area, we've been coming up, a colleague and I, Ashley Putnam and I, have been coming up for about 1.5 years to run this process that we call a research and action lab, Anchors, and we named it Anchors for Equity. And it has these 4 phases that you see here, where we spend a certain amount of time discovering what assets there were in the community, what role the eds and meds currently played, what other worker supports existed in the community, kind of defining how the community is going to identify a pain point or an opportunity that they could dig into a little bit more, design around that issue, and then deliver a solution. And here you can see the range of activities that we've had, including stakeholder convenings, community conversations, and a certain amount of external research. I'll go to the next slide. So we're in the design phase right now, and what I wanted to summarize was sort of an elegant graphic here that describes that what has emerged from the discovery and define phase are that there's a collection of what we refer to as emergent workforce in the area, and I think these are reflected in some of the out of labor market, underemployed folks that Jill identified as well. People who are currently disconnected, and it can include youth, it can include immigrants who haven't translated their credentials or experience from their home countries to the US context, adults who've been out of the workforce either to care for a family member or kids or for some other reason and are now ready to get back into the workforce. We're referring to them as emergent. So they might not have a lot of training, they might not have a lot of relevant job experience, but they're ready to work, and they need some supports, but they're ready to work. So that's a population that was kind of got a lot of discussion throughout this process. At the same time, what we were hearing about was a region with an aging population and changing trends in healthcare, where people were staying for less time in hospitals, right? Hospitals were discharging people sooner. People were aging in place, not in institutional settings. And these were creating an increased need for care workers in different settings. In addition to the existing care work that we saw from Jill's data that showed a high demand for nurses, there's also an increased demand for care workers in non-institutional settings. And so we take these two things together, this sort of emergent workforce that's looking for a pathway into a career, into jobs, an aging population that is going to need more care and a variety of different kinds of care. And we see that as creating this opportunity, the opportunity to grow rather than poach healthcare workers. Because I should say that kind of a third thing that we heard from healthcare employers, both hospitals and others, was that there's a tendency to, train somebody up, have them working at your institution, and then they move to another institution. And wages in these jobs are relatively low, such that $1 an hour increase in pay could very well be a reason for somebody to move from one healthcare setting to another. And so you have a lot of retention issues among existing workers. And what if we could take a more collaborative approach among healthcare employers and look for ways to grow talent? And we'll turn to the next. So we're really at the end phase of this engagement, the deliver phase, and we're working with the Institute to dig into some data a little bit further. And these are the next steps. We're identifying some very specific high need care positions. So care jobs, it's a pretty capacious category. What are we really talking about here? So what are the actual roles and how can we identify them, both through quantitative research, but also talking to care employers individually about the positions they find the hardest to fill and retain. Then we want to have a conversation around quality care jobs and career pathways for emergent workers who are looking to get into the workforce. A first job is we all shared our first jobs, and they might not have been the best jobs of our careers, but they were a way in, and we all probably learned a tremendous amount from them. And so a first job and a way in through a care job is terrific, but it really does also need to be a pathway job. That worker has to have the opportunity to earn a greater wage, develop their skills, take more responsibility, and see a path towards greater engagement with work. And so we want to have a conversation around how quality healthcare jobs can become that. And then third, what are the existing training needs and training resources in the community? There are a lot of colleges and universities, but oftentimes these workers don't require a 2-year or a 4-year degree, but can the education partners and institutions in the region either partner with others or on their own develop other kinds of training and educational programs that satisfy the need to get these workers up to speed to do the kind of care work that's needed. And then talk to employers, those who are hiring care workers and have the demand. What kinds of commitments are they able to make to hire workers that go through the training programs that we've identified, and maybe even more significantly, advance those workers throughout their enterprise, so that these jobs don't just become entry points and dead ends, but they become entry points and career ladders. So that's where we are in this process, and we hope to have something to a framework to share back with the community in the spring. And at that point, we leave the engagement. We always love staying in touch, but we want to leave the community with something, a framework to build on and grow, based on this, what will be eventually really a 2-year engagement with the anchor institutions in the region and community and economic development folks as well. So that is Anchors for Equity and the Anchor Economy Initiative, and happy to answer questions that people might have.
Does anyone have any questions for Deb? Thanks, Deb. That was really enlightening and very much connected to what Jill presented throughout the process. So, all right.
We may have compared notes ahead of time to make sure.
All right. Well,
Okay, next we have folks from Geisinger. I'm not sure if Kelly's here, but I added her here, and I know Nancy is here, and I think I saw Andrew come in, so we could get started with you all.
No, that's great. And I'll actually ask you to go back a slide. I'm just going to do the intro. Andy's really the one that is the director for all the programs and really understands the details. So he'll lay all those out. But just a couple quick comments. When we consider ourselves an anchor institution within our communities that we serve. So we do believe it's an imperative for us to partner with these sorts of initiatives and kind of bring our resources to the table to help. We employ about 25,000 people at any one point in time across our entire footprint. And another interesting thing about Geisinger is being a nonprofit, we can partner with federal, state, local funders, as well as individual donors to help shape these programs. So they're not just good for Geisinger, but they're good for the community at large, which is really something that's, I think, really important for what we're talking about here. Workforce development, we believe, is very strongly tied to economic development and lifting our communities. So again, being a mission-driven organization, part of it's making certain that we provide the highest quality care, but then secondarily, making certain that we're lifting the community with all the work that we do. Some of the things that Andy will share include, how are we reaching into middle schools and high schools? How are we helping to engage people with that first job or that return to work job, and not making it a position today, but a career for the future and what that looks like. They've done some really creative and innovative things. So I'd love to turn it over to Andy to talk about what we're doing, and then ideally how we can then focus on partnering together to take this to the next place. So Andy, I'll turn it over to you.
Thanks, Nancy. Appreciate it. So as everyone's mentioned on this call, right, we've heard of all the challenges that we face, I think, across the nation, but more specifically within our region. I'm in the healthcare arena, and you can go to the next slide if you don't mind, please. Thank you. We've looked at, how do we generate that next talent, right? How do we generate that interest within the healthcare arena? How do we make it a career profession, right? So some opportunities we've looked at, we started obviously, even as simple as our volunteer services. So I'll kind of work left to right. I'm just going to go through a few of these, and then I really want to kind of hone in there on the green one. So our co-op pathway, because that I think paints a wonderful story. So our junior volunteers. That's one way. It's an opportunity for 15 to 18-year-olds hey, I want to give back to the community. I want to learn about team building, communication, problem solving, all those type of things. So this provides them with those tools. They get that kind of entry level. Hey, what is it to have a position, right? So those soft skills. It's about 4 to 6 hours that they're there a week on their own terms. But really, it's to give them that exposure, like we said, just to kind of get their feet wet and see, hey, is this something that interests me? From there, we have what you see there next is Aim High. So what that is, it's a 1-day immersive program, and we talk all about healthcare. So what opportunities exist? So, hey, do I want to be a life flight nurse? We have a life flight nurse there, right? We have someone from our EMS services, our trauma services, our nursing, and so on and so forth. One thing in healthcare, we realize, right? We're one big team, one big family, right? So there's more than just those nurses, doctors, aides, techs, right? There's a multitude of roles that make us successful. So we want to showcase everything and every opportunity that's there. Reach High, so that's a partnership with our medical school. And then it's academic enrichment opportunities. So for those low-income families, first generation to college kind of students, right? That's the target population in them. And I know they see a couple hundred students throughout their programs. But once again, it's to say, hey, these are all the career opportunities here for you. Here's how to get to it. Here's some grants, right? Here's some funding that might help support you. For our own employees, we also have what's called our SAW program. So it's school at work, right? So can we give them those tools, as we're all mentioning, right, to get to that next step? If they want to further their career, we want to give them those soft skills, those opportunities to be successful. The co-op program, so I'm going to hang tight on that one because I really want to go into a lot of detail with that. But some other paid training opportunities. So we understand, right, pay might be an issue. So we'll actually pay them to go be a certified medical assistant. So they'll go through our program, and at the end, they'll come out with that certified medical assistant and a job. We have an EMT program, phlebotomy. There's a military bridge program. So just some great opportunities there. And then we get to our college and university. And this really impacted us during COVID, that I would say that hands-on training, right? Those clinic, and I'm a nurse by profession, so I'll be biased here, right? It's those clinical skills. We saw a big deficit. So we said, hey, from an institution standpoint, what can we do to help support? How can we give these students those skills, right? That they're going to be going out to the workforce in under a year, some of them. So can we give them the tools to be successful? So that's why we implemented a lot of these college and university programs in that accord. To get back now to the co-op program, so what that is that's our high school program. So I could say in the Northeast region, we first started it, we had under 20 individuals that participated. So what they did is they would come for usually around September timeframe, and they would go till they graduate. And it really was that opportunity to say, hey, what is healthcare all about? Is this something I want to choose? Originally, we were very small, so we had either in our clinic side or in our inpatient nursing side. And they would come in, right, do those skills, and at that end of that opportunity, they had the ability where, they can obtain a job for them. But they got the hands-on skills and training. So speaking with a lot of them, they had that where they said, hey, I went into my freshman year of nursing, and now I have all these resources. And yes, I know that, right? So it gave them the tools to be successful. That program has now since morphed. We've seen almost over 100% growth rate. We're seeing many different high schools apply into it. So we've that huge community outreach. The students, we're seeing them successful. They're saying, hey, we wish we had these tools to be successful. They're learning those soft skills, right? So how do I write a resume? How do I do an interview, right? How do I manage my own bank account, right? So they're learning all those soft skills. We're giving them that paid opportunity so that does help support them. Because just like we mentioned, we're starting to see all those challenges. So transportation, right? That's a challenge that we've kind of faced in there. Other challenges, as simple as scrubs, right? Because usually for a job, right, you need to purchase scrubs, right? That was some challenges that we saw faced. So we looked at a lot of our programs and we said, what are some opportunities that we can do to kind of standardize? So we standardized the uniform. So Well, if they stay on after the program, they wouldn't have to buy a new one, right? We looked at different opportunities. So we have a scholars program where we give, and I'll use nursing for example, we have, if they stay with us for 3 years, we can do $40,000 tuition assistance to help them out. And what we saw with that is a lot of individuals that said, hey, I never thought I'd be in my, I'm the first one in my family to be able to go to college, to be able to go to school, to become a nurse. So we gave them the tools to be able to be successful in that. But I could say the program has we've seen tremendous growth. The opportunities to see how well prepared these students are coming out, to have those tools and those resources going into nursing school or going into healthcare. And honestly, whether or not they choose their particular profession, right? It gave them that ability where it's saying, hey, here's the tools to be successful in life, right? And other opportunities that evolved. With that co-op program, so last year we sat at approximately 7 different co-op opportunities. And now we're looking to add an additional 5 more. So it'll bring us up to a grand total of 13. But like I mentioned earlier, we focused it on that almost that holistic approach of a hospital, right? So we're looking at now facilities. Is there the opportunity there? IT world, right? Pharmacy, nursing, radiology. So all those different disciplines. We're also looking at, this is an opportunity just to talk with students, right? So if they're interested in a field and let's say they don't participate in the program, can we have them talk to a professional in that career, just to showcase, hey, this is maybe some steps to get to that next step in your career, and really just to review that information with them and give them a path to success. Really, that's what we want to do with these programs. Is we always like to say it's painting that roadmap to success for them. So if they want to join healthcare, here are all the opportunities, and here's how to get to your end goal, and we're there to help support you along the way. So that just showcases some of our opportunities that we offer, but would love to partner, as we mentioned, with some community support, obviously to figure out some of those transportation needs, and some of those other factors, right? The financial pieces. We see that play into all facets, right? And I think all of us have experienced that. So, whatever we can do to support and also have that community support, it's the greater good and it's the right thing to do.
Thank you, Andrew. In that, we have a question in the chat. Do you have a higher ed or training partner for the school at work, or do you do that training in-house?
So we actually do that in-house. We have some individuals that kind of dedicated their time and they'll actually help. So we'll work with the schedule as well, with that employee's schedule to find the time. We've seen that usually they'll do, like I saw some classes they'll have, well, like after 4 o'clock, let's say. They try to pull what's best for the students because we understand, right, those other life factors that come in. But really it's there to help support them and their needs. So they'll work with that class and come up with that individualized plan.
Were there any other questions for Andrew on this slide? Right. Thank you very much.
Perfect. And I'll kick it back over, Carrie, right? I think you're up.
Yes. Thank you, Andrew. And, you really highlighted some very effective strategies and approaches that I'll kind of build on that, but it's some of the best in class work when an anchor institution, you'll hear all the things that like Jill talked about and Deborah talked about coming together here, and with what I'll present, where an anchor institution really takes initiative to build these types of programs that prepare a workforce in recognition of their own labor demands, and looking at a region and how are we going to make sure that you're building the workforce you need to meet those demands. So with that, I will start my presentation. Corin, bear with me. I might, just seeing who our audience is here, I might skip through some things. So I'll just try to pay attention to what you're doing and move us along to the next slide as needed.
Let me know.
I will. Thank you. Thanks for running the show here. I'm just going to start with a little bit of background. If you go to the next slide, and the next one, Jobs First we're a nonprofit workforce intermediary, and we have a grand vision for all economic mobility for all young adults. And our mission that you see here, to create and advance solutions that break down barriers, transform the system, supporting young adults. Before you go to the next slide, it just, Jobs First, we launched in 2006, really founded at the time of a crisis that you heard Jill talk a little bit about here, and some questions that came up with you all about out of school and out of work young adults. And, we're based in New York City, and we're expanding the work across the country here and working with the folks in NEPA. But Jobs First launched at a time where there were such high numbers of out of school, out of work young adults in New York City. And when you combine that number with the unemployed and the underemployed together, was 35% of all 18 to 24-year-olds in New York City, and well over 200,000 people. And philanthropy and nonprofits that were serving young adults came together to think about, how do we address this issue? There were not very many workforce intermediaries in the country at the time. And I don't know of others that were focused solely on young adults. But the people that were serving young adults felt that some sort of mechanism was needed to stay focused on that population if we were really going to do something about it. And so, we looked at this crisis and we thought, well, how do we move out of crisis without collaboration? And we felt that was the key. And our role as an intermediary is really to align these systems. Somebody mentioned like systems that bring people from education to success in the workforce are pretty siloed. And so it really requires intentionality. And so that's how we formed. So if you could bring the slides back up, and I'll skip you to where yeah, that's perfect. That was it. Back one, sorry. So we work across systems, and everything we do is through partnership, mainly public-private partnerships, but it's very much, people-centered work through all of these different stakeholders. Next slide. So the key areas that we've identified of where we focus our attention on is in community, education, work, and policy. We have found that designing, launching large-scale solutions, working together across all of those partners that you saw that focus both on practice and policy changes have been the most effective way to create a more effective system and improve results. Next slide. So there's a lot on here. In our work in these areas that I talked about, we've launched and supported more than 30 initiatives across education, community, work, and policy in New York City. Next slide. This is mostly just to tell you we hold ourselves very accountable. We've developed an impact framework that focuses not just on people, but on the quality of partnerships, changes and improvements at the institutions that are part and businesses, corporations that are part of these partnerships, and ultimately at a systems level, how are we improving systems, have systemic conditions improve through our work. On the next slide, I wanted to throw in this quote from the U.S. Chamber of Commerce. This caught me. I see things like this. I've seen things like this for a number of years, but this one's really recent. I think it's from this month. And they said, "We hear every day from our member companies of every size and industry across nearly every state that they're facing unprecedented challenges trying to find enough workers to fill open jobs. With the latest data, it shows that we have 8 million openings and only 6.8 million unemployed workers." Now, I put this here and I think about what what Jill said and what I said, that unemployed workers are only the people that are counted that are looking for jobs. There's all of the people that are not counted that stop looking. They might have been unemployed long enough that they're not receiving unemployment. So there's a whole other workforce, and very often out of school, out of work, young people falls into that other workforce. So coming up with the types of solutions that will connect people to work it's not just crucial for the nonprofits here that have joined us here that are doing this work, but I want to point out, again, Geisinger recognizes this, right? If we're not building our workforce, then we will struggle. Okay, so I'm going to talk a little bit about two projects out of all of those ones that you saw on that busy slide that really focused, had some intentional focus on healthcare. The Young Adult Sectoral Employment Project, although there were partnerships that focused in many sectors, this one really established the most promising approach to improving how well 18 to 24-year-olds who are out of school and out of work are prepared to succeed in the workforce. And so I lift this up because as we come together to think about how we're going to do that, how NEPA is going to do that, how all of you, both employers, nonprofits, chambers of commerce, bids, everyone who's involved in solutions. The Young Adult Sectoral Employment Project really is one of the most promising practices. And the second project I'll talk about is really about taking that to scale. But I call this YASIP for short. It's an evidence-based model that Jobs First conceptualized in response to findings from a random assignment study that came out in 2011. And that was an evaluation of 3 sector training programs across the country in manufacturing, in healthcare, and in tech. And ultimately, the findings were that sector training programs are much stronger. And we used a very clear definition of sector training programs that meant employers are at the table from the start, similar to what Geisinger is doing. They inform curriculum and they invest in the solutions. Next slide. So this shows you the partners who were at the table. In these, I'm just looking quickly. So comprehensive youth development, CHCA, PHI, FIPS, and is there another? Isaac Center. All of them were doing work in healthcare. So you could see out of 10 partnerships, I think I named 3 or 4 of them that focused on healthcare because similar to your region, healthcare is the highest demand. And it is the industry that has the most entry points for people without a college degree. Of course, you might need a college degree to advance into nursing and things like that, but there are a lot of entry points for people that come out of training programs with a certification. And so Jobs First, our role in this work was really supporting the development of these partnerships. Each partnership focused on a specific sector, healthcare, tech, transportation, and all of them had employer partners at the table, driving training and making sure unemployed and underemployed young adults were getting the skills they need. What was different about these programs than some other programs that were out there already, where maybe young adults weren't finding as much success, is that these really lengthen the on-ramp, they lengthened the training program, and they built in some very intentional youth development principles to ensure that young adults were successful. Next slide. I think I talked about this already. Next slide. So I wanted to just point out what did success look like? These programs, 10 new sector training partnerships launched in New York City. 3,100 young adults received training. More than 1,300 of them earned industry recognized credentials. Even more gained incredible skill sets. There are trainings, a lot of trainings in tech that actually don't have a certification associated with it, but they were training people in software development and some other tech skills that you don't need an industry credential to get really good jobs in those. More than 1,400 young adults were employed, and you can see there were employers engaged in the process, more than 50, and a lot of money was raised or leveraged. And what that means is because these programs were so successful, the city invested in supporting them year over year. They continue to this day. These launched in 2014 and 2016, and they're still running, and they continue to get investments from both public and private philanthropy. I think what was key is that retention numbers for this population, these projects focused on out of school, out of work young adults, retention was very low. We were seeing retention rates of 30–40%, and these training programs were seeing retention rates of 75%, which was a really big pivot. Next slide. Before I talk about this, I wanted to talk about one program that I had mentioned. It was comprehensive youth development. In their model, they change, and I think this might be interesting for those of you who work in nonprofits and design programs and even community colleges, and if there are employers in the room, they changed their model from they had a 3-week recruitment period where, they exposed people to careers in healthcare. They talked about it, but they were finding a lot of people dropped out of the training. They weren't retaining people through to complete the training program and get the certification. And through this learning community that we did and talking to employers, they extended their recruitment period from 3 weeks to 8 weeks. And what they did is they brought in a lot of people who work in healthcare to talk to them. And then they did whatever they could, they did an on-the-job exposure event, because people think they want to work in healthcare. And they don't always understand what that means, right? Even like the simplest thing of potentially being exposed to like bodily fluids. And that sticks out in my head because I was at one of their information days where they had an alumni of the program and a certified medical assistant come in and talk about that, right? Like, you will be exposed to bodily fluids. And, there are other careers in healthcare that you might not be, but what you're training in here as a certified medical assistant, you will be. So they had the opportunity to talk about maybe medical billing or, other types of occupations in healthcare that will change, might be a better fit for you. So I just, wanted you to kind of contextualize, like, what are some of the things they did to improve recruitment retention? Thanks, Corin. I could keep this part short in case you have questions or want to talk about that. I want to make sure we leave time for that and this call to action that we talked about. But, fast forward a couple of years after we launched YASP, we were looking at this pandemic impacted world. In New York City and everywhere, really. But our focus here, understanding that sector training programs are usually expensive. Employers need to be at the table, they invest in it. And because of that, each of them serve at the best a few hundred people a year, because the trainings are longer and the investment is larger. And we wanted to think about how do we have greater impact. And over time, when we launched the YASP, there were very few sector training programs, but by the time we finished 2 rounds of learning communities and launching new programs, it became common knowledge that having industry involved in your training, whether it's at the college site or a nonprofit site or at an employer, it improves the outcomes. And so there were more sector training programs that launched in the time that we were talking about doing this work. And so the pandemic comes, and the number of out of school, out of work young adults, it almost doubled during the pandemic. It came back down toward the end of the pandemic, but we wanted to think about how do we scale this practice. And so we brought together in 3 different sectors, the green economy, the healthcare sector, and tech, training programs by sector. So for this session, I'll focus on the healthcare sector, where we brought together, you could go to the next slide. We brought together a range of healthcare training organizations, and they launched the healthcare sector network, and you could go to the next slide, and established a mission statement, a vision statement. It's a very strong partnership, a deep partnership, where they wanted to come together to strengthen their workforce development, partner with employers to meet the demand, the increased demand in healthcare. I think no sector was more impacted. The workforce was more impacted by the pandemic than healthcare. And so they wanted to work together and make sure that there's a thriving healthcare industry and training is accessible. They're looking at pay, fair pay, the job quality, and really just increase economic opportunity. On the next slide, you'll see they set some really strong priority goals. Together, they are partnering with employers. They're strengthening pathways and creating advancement strategies, which has been really challenging in the healthcare sector. They are focused on marketing the sector. They see, the impact that the pandemic had on this sector, and it's kind of got a bad reputation through that. And, being that frontline workforce that had to deal with what happened more than any other sector, they feel like there's a campaign needed. They want to partner with employers to do that. And they're working together to really define and share out what works, this best practice. Next slide. These are the partners, and you could see there's a community college along with those other partners there that are nonprofit workforce development training organizations. And they are collaborating with large healthcare systems like Memorial Sloan, like Montefiore, which is the largest employer in the Bronx in New York, and 1199, the union. Next slide. Just quickly, want to point out their wins and what they're planning, and then we'll open up for questions here. So in their first year, they hosted with 12 employers, the union, actually a virtual reality headset that does training in healthcare was there too, which was a big hit, an inaugural Careers in Care Expo. Lots of young people attended, met employers, learned about healthcare. And we're doing that again this year. They're working with employers to design an advancement strategy toward better paying jobs. We learned that, for example, surgical tech, there's really high demand. And in New York, the average salary is $75,000, which is a big jump from some of the entry point salaries that are closer to 40, 45 in healthcare. And they're bringing new employers to the table. And next, and I think my last slide, this year, they are really focusing on this no wrong door approach, which is like a cross-network referral, so that anyone seeking training has a place to go. And they are having the second Career and Care Expo, moving that expo from what was conceptualized as exposure to a place where employers will actually do hiring. And they agreed to invest in some of the money that we raised for them in a labor market intelligence tool, so that they are very prepared to best align training to the skills in demand. And then they are also focusing on policy and building their policy advocacy muscle to address job quality. Okay, I shared a lot. And you could probably take down the slides before you go to yours, Corin, so we could see each other. I know a lot of people are off camera, but if you have questions for me, you could come on camera, put them on chat.
Or just unmute.
You know, it's interesting because you had mentioned, who's on the call. And as I look at the participants, it truly is a variety of, like you said, college, university, community college, workforce intermediary, chambers of commerce, employers. And so I'm interested in look at a lot of the stuff that you highlighted. I think, there's so many parallels that are relevant to this area in some of the elements that we could focus on. So I really look forward to what the call to action will be and how they align with a lot of our goals.
Thank you,
Sure.
Laura.
Can you share a little bit about the operating structure of the network and is there a backbone organization? How is it funded? Who's in charge? How does it get all this work done?
Yeah, I didn't want to get into the nooks and cranny of that in my presentation, but because I wasn't sure of the audience, and there's only some people that's interesting too. So I'm glad you asked, because I could talk about that. But we have a pretty deep partnership development process, and that we went through with each of these networks that took easily a year, probably longer. That starts with trust building. And goes from trust building to identifying barriers, opportunities. A lot of the work, I'm sure, that's been done with NEPA Moves and NEPA Thrives. But fast forward through many steps I will leave out. Toward the end of our process, we look at governance, a partnership model, governance structures, identifying leadership. So all of these partnerships have leaders or steering committees, signed MOUs of how they partner, what they will partner on, what their roles are, what they commit to. And as far as funding, I did leave that out, so I'm glad you asked. Jobs First, we don't use the backbone terminology because we're an intermediary and we just say we're an intermediary. But I guess if you were looking at a collective impact model, you would probably say Jobs First acts as the backbone for at least the first 3 years of implementation for any of our partnerships. We kind of commit to doing that sort of administrative support, facilitation, bringing in experts, and fundraising. Jobs First fundraises for the partnerships, re-grants money from day one of implementation. So when they say we're ready to implement, they have a plan of implementation, they have goals, strategies, activities, all of that. Jobs First re-grants resources that we raised for them to do this work. And then we also support a process to continue seeking resources. For example, I hate raising this example because we didn't get it, but it's a good one. We applied for our Green Economy Network for the NOAA, which is the National Oceanic something Association. I forget what the other A stands for. A $10 million federal grant, which I'm actually kind of glad we didn't get now because the money's being clawed back, but won't talk about that elephant in the room. But we've applied for really large opportunities and small, and been successful on some of the smaller ones, but not that large one. Thank you for the question.
What would you say is the biggest challenge that you found in bringing sector networks together to kind of get to these successes and these wins?
Oh, that's such a good question. Everyone knows partnership is hard. Collaborating is hard, especially if it's not seen as like your primary role. It might be harder for nonprofits who have scarce resources to devote time to something other than what all of the grants in front of them say are their deliverables. So what's the biggest challenge? I'm not sure. I'm gonna flip that over to say maybe what's addressed some of those challenges is identifying your leaders, because partnership is hard. And I can name so easily that your champions and your leaders kind of bubble up relatively quickly as the people who see that the mission of this collaboration, the goals of this collaboration, the success of this collaboration helps them do their job better. And it's the same goals of their organization. Once you help them, it takes work, as the backbone or as the intermediary to really make it clear that our goals are the same. It takes probably a little bit of work, not a lot, to say, you want more people placed in jobs. You want people in better jobs. You want those jobs to pay more. You want them to stay in those jobs. You want them to advance. You want more education opportunities. And when everyone kind of sees we have the same goals, if I contribute a little bit more to this collaboration being successful, my organization will reach its goals more quickly as well. So I flipped your challenges to kind of secret sauce, but yeah, I hope that's helpful.
Thank you. All right, so I'm going to go back to this and just kind of thinking about as we move forward throughout the summit and then throughout the work with NEPA Thrives and NEPA Moves, some of our housing coalition pieces. Were there any challenges that stood out to you today that the panel discussed, or any specific barriers that the organizations in the room would like to address? And I will start with that one. And you can come off mute or put it in the chat. What stood out to people today?
What stood out to me is that, there's a variety of partners, potential partners here that could really, work collaboratively on advancing specific issues. And I think that it's just a great cross section. And I think a lot of great data was presented, a lot of great models. I think that there's, really opportunities to elevate and connect a lot of these pieces. So I'm hopeful that we could start to move the needle on some of these components with Thrives. So just a big thank you to everyone that participated.
Something else that stood out for me is the employment pool, or the available unemployed or underemployed employment pool does exist according to the data. And so there is opportunity there, and it's just, I think it's trying to figure out how do we reach those young people or those individuals who they want jobs, they want to be working, but they're just not there right now. So I think that those are two pieces of hope, just for me, in my opinion.
To your point, Corin, I think the opportunity youth and the drop off of population in our region, it's really illustrative of the need to focus on these particular populations and the emerging populations because of the challenges here. It's very illustrative of that.
Yeah. All right.
And just a quick comment, Corin, I would echo what was just said. And I think what's also encouraging is it seems there's a lot of energy around some of the work that's happening right now. And so for example, like with Paul Nardone, like how can we help? How can we participate? Where are the gaps? So I think that not only is there some elevated areas of interest, but also partners that are coming to the table to help address that. So I think if we can look at some of those gaps, maybe create an inventory of what that gap truly looks like, ways to attack the gap, and then monitor and track it, I think we can truly make a big difference in these communities.
Well, and I think for me, for this session, just to second that, Nancy, like today we're seeing, we're focused on the care economy. So we're seeing, a part of that sector come together, which is wonderful. And I think offers a lot of opportunities. And I hope as we move forward in next week's session, where Jill will present again, and Carrie and her team are going to focus on outside of the care economy and in industry and business throughout the region, to see more of those people coming together and realizing that there's energy and it's time to make changes.
I know there's
Um,
additional folks on this call, Corin, from the Scranton Chamber, from AHEC, et cetera. I know that you mentioned this was also recorded. I'm thinking of additional ways we can continue to move this webinar out into additional sectors. So just thinking about ways we can do that and coordinating with people to do that, because there's a lot of valuable information shared here.
Absolutely. So in that, I think right now, I mean, we know that there are challenges, but what would we say is the biggest workforce need that you have in your organizations right now? Is it recruitment? Is it retention? Is it skilled? Is it training? Is it, the soft skills? We hear from so many different people, but for this group in this moment in time, what do we think is the biggest challenge?
I can jump in, and I really can't respond from an employer perspective, but we do have an internship program, and we get to work with a lot of students from the region's schools. And I've noticed that some of the things that they struggle with are kind of they're very, very advanced in a lot of, different technological tools and hard skills and things like that. But things like technical writing, some of like the basic fundamental skills maybe have kind of gone to the wayside a little bit more. And that's just sort of an anecdotal thing that we've seen. So I'm not sure if any other employers have noticed that, but just things like basic writing, email communication, that kind of stuff.
Andy, could I put you on the spot for a second? I know that you had recently done some kind of research into this, the barriers from a Geisinger perspective. Are you able to share a couple of things, or is it not quite
Ye-
ready for that?
Yeah, no, I was actually planning on it, but yeah, some of the things that we face. So obviously some of those soft skills, right? So like the resume writing, things like that. One kind of new thing that kind of came up recently is coping skills. So we're working with our team too to look at that. But that seems to be, we see that transcend. So whether it be those co-ops right at the high school level, we see it go to the college and university level, and then we see it on employment as well. That's a kind of hot off the press, the new one that we're seeing. But a lot of those other basic skills we're working with. So like setting up a bank account, right? Like I mentioned, the resume piece. Just those social skills, I would say communication, that's a big one. Um, Attendance, that's been an issue from, I would say, like the high school arena. But what do I mean by that? It's just even just the proper communication, right? To do those call offs and things like that. So those are some of the ones that we're seeing. I would say really it's that coping skill though, that's been kind of the newest for us to learn to kind of how do we give them the resources to help out, and that's yeah.
Thank you.
When we embarked, so I'll add to that coping skills component. When we embarked we kind of did a mini community needs analysis when we were building a careers in care scholarship program in the region, and the resilience kind of piece in terms of the healthcare professionals training really came up and resonated, as well as an opportunity area for investment and how we can keep a lot of students at the table in that. So I'll say that was also echoed in what we learned for a lot of the nursing programs, the other elements of the healthcare sector program, that particular piece.
Well, as I want to respect time and we don't have much more time left. One of the things that we would like to do is, continue to bring together the individuals who are really committed, the organizations, individuals, and businesses, employers that are really interested in kind of figuring out how to take all the work that the Institute has done in partnership with Deb and Anchors for Equity, and understand how, we can, move move forward on creating some solutions, whether, through sector-based processes, and, commitments. And so in that, what we ask is please reach out to me at any point in time. But we're also gathering on May 1st at Benko Dental from 9 to 12 to kind of do a wrap up of today's session. And then additionally, we're always looking for people to participate if it's specific to this. So sending me your email, reaching out, sharing with me that this is a conversation that you want to continue would be excellent. Right now, Carrie is sharing in the chat the slides from today. And then the other thing that I would ask you to do is for her presentation, if you would go ahead and scan the QR to kind of get feedback from today's session, because I think that will be very helpful. And then again, coming up next week, Jill will present the first part again for those who are unable to make it for today. And then the second part of the conversation next week will be about sector-focused collaboration outside of the care economy. And then throughout the entire length of between now and May 1st, we have some really exciting sessions going up, talking more specifically around the barriers and how we can, what's happening out there, what positive things are happening, and then where some of the challenges are and where people can kind of participate on. So again, Thursday, March 6th will be the workforce landscape. On the 12th, we're going to have some workforce strengthening organization presentations. We're going to do our child care panel on March 19th. On March 21st, we're going to do an employment resource panel, and then we're going to keep going every week right through May 1st with more. So if you want to scan the code, that will bring you directly to the registration links. I would like to say thank you to our sponsors for this event. Both when it was supposed to be in person and now they've been wonderful champions, and they come to the table to do this work with us. And we are so appreciative of their contribution and time. And then finally, I'd like to thank all of our presenters and panel members for today. I think that there was a lot of great information that was out there, and I truly, truly appreciate the time you've spent here today. And I ask you to share, if you enjoyed yourself, share it with a colleague and see if they'll come back for one of the other sessions. And with that, I will ask Laura, is there anything else that you want to say to wrap up the event for today?
No, I think we have a lot of incredible models that were shared, a lot of organizations doing fantastic things, and an opportunity to really kind of implement elements of a call to action in some of the collaboratives that we have and build upon them. So look forward to continuing the conversation on a weekly basis and hopefully deepening this one, and appreciate everyone participating. Thanks.
Thank you very much. You all have a great day.
Thank you.
Thanks, everyone.
Bye.
Thank you.